Self-care is important for anyone really, but especially for somebody who's been diagnosed with cancer and those supporting them, because it improves their mood. It helps them become a bit more confident in understanding how they can help themselves feel better, and that will empower them also to speak to their doctors and other healthcare professionals in a more clear and concise manner. And I also feel that self-care is something that somebody can do for themselves, especially when someone's been given a diagnosis of cancer. They can't do anything about that. They don't really have control over treatment. They don't have control over the scans and what else is going on. But the one thing they have control over is how they can manage their own well-being. There are 3 things that you can do to enhance your self-care. The first step, I think, is to continue doing something that you've been doing every day. So, for example, if someone was going to work and putting on makeup, it'd be quite nice if they continued doing that, even if they were at home when they were having treatment or when they've had surgery. The second thing is to perhaps spend some time with trusted friends or family members and allow them to help you if you need help, or even just come and sit with you when you're watching television or doing something, because that way you feel supported. And the third thing is to try and do something nice for yourself once a day, whatever it is, even if it's like sitting down to have a cup of tea without any other disturbance around. Just enjoy the tea, or maybe look out of your window and see what's going on. So something different each day that just makes you feel happy and joyful. I feel habits and routines are an important part of self-care, because we are creatures of habit, and it gives us a purpose. So I feel that self-care is enhanced when you continue a routine or habit that you've been used to. It can be difficult during a cancer diagnosis, both for the patient and sometimes the carer as well. But, simple routines like maybe keeping to your bedtime and what time you wake up, making sure you have your meals at the same time. Maybe if you were going out for a walk daily, trying to incorporate that. If you were seeing friends, for example, even if you can't go out, maybe you could get them to come over. So just little things which you can incorporate into your life. Some common obstacles that people face when they're trying to look after their well-being after a cancer diagnosis are time constraints, a feeling of not being able to do anything, really not quite sure what well-being strategies are going to help them, and also whether it's really worth doing them or not. And the fourth one is people really not knowing how to manage their well-being and self-care.